The golden years, that long-awaited chapter, a time envisioned for relaxation, for enjoying the fruits of a lifetime of hard work. Maybe it's quiet mornings with a cup of coffee and no deadlines, grandchildren's laughter filling the house, travels you finally have time for. But for millions of Americans already retired or standing on the cusp of it, that idyllic picture is increasingly clouded. It's being obscured by a growing, persistent fog of anxiety. It's the gnawing worry about an unexpected medical bill that could vaporize decades of careful savings. It's that vague, unsettling feeling of unease when watching the evening news. A sense that the world outside your door is becoming less predictable, perhaps less safe. It's the quiet fear of becoming a burden, financially or otherwise, on the children you raise to be independent. Does that feeling sound familiar? That low hum of worry beneath the surface? You're not alone. Recent surveys consistently show that a significant portion of Americans, sometimes more than half, believe that living abroad would not only be cheaper, but could offer a significantly higher quality of life. But is this mass migration of Americans retiring abroad just about stretching dollars and cents? Or are they chasing something far more fundamental? Something perhaps less tangible, but infinitely more precious? Something America itself seems to struggle to guarantee its citizens anymore. Simple peace of mind. The Healthcare Gamble, USA. Let's start with the biggest source of anxiety for many American seniors. Healthcare. It's the elephant in the room of every retirement plan. We're told Medicare is the safety net. You paid into it your entire working life, diligently, faithfully. It's supposed to be there for you when you need it most. But what is the reality for millions on the ground in 2025? Medicare Part B premiums continue to climb. Out-of-pocket costs, deductibles, co-pays, can still be substantial, especially for chronic conditions or unexpected hospital stays. And critically, traditional Medicare leaves gaping holes. Routine dental care? Often not covered. Eyeglasses? Generally not covered. Hearing aids costing thousands? Almost never covered. These aren't luxuries. They are fundamental to quality of life as we age. So seniors are forced to navigate a confusing, expensive maze of supplemental Medigap plans or restrictive Medicare Advantage networks, adding hundreds, sometimes thousands, to their annual healthcare spending. The numbers paint a stark picture. The United States spends vastly more per person on healthcare than any other developed nation on Earth. Roughly 17% of our entire GDP, according to the latest OECD health statistics. That's nearly double the average of other wealthy countries. Yet despite this colossal spending, our health outcomes often lag behind. Americans have a lower life expectancy and higher rates of preventable deaths compared to citizens in countries that spend far less. It's a paradox that leaves many feeling frustrated and shortchanged. But beyond the statistics, it's the personal cost, the fear of that cost, that truly corrodes peace of mind. We've all heard the stories, maybe even lived them. That unexpected trip to the emergency room for chest pains that thankfully turned out to be indigestion, followed by a bill that could easily reach $3,000, $5,000, or even more if your insurance deems part of it out of network or questions the necessity. It feels, as one person in the original script aptly put it, like walking into a casino. You spin the wheel, hoping for the best, terrified of landing on financial ruin. Consider the price of prescription drugs. A study by the RAND Corporation found prescription drug prices in the U.S. are, on average, 2.5 times higher than in comparable OECD countries. A vital medication like Humira, used for rheumatoid arthritis, can cost over $5,000 a month in the US, while the same drug might cost $1,000 to $2,000 in Europe. Insulin prices remain notoriously high, forcing some seniors to ration doses, a dangerous gamble with their health. This isn't just about affordability, it's about dignity. It's about the stress of navigating prior authorizations, confusing formularies, and the constant worry about hitting the Medicare donut hole. And the fear is pervasive. Let's revisit that story of the man suffering severe stomach pain. His first immediate thought wasn't about his physical well-being. It wasn't, "What's wrong with me?" It was a cold, hard calculation. Can I afford the hospital visit? Have you ever felt that? That chilling moment where financial fear eclipses physical fear, where the potential bill feels more threatening than the illness itself? That feeling is tragically common. Imagine being a 70-year-old widow, living primarily on Social Security. Your doctor prescribes a new heart medication, essential for your survival. But the copay is $150 a month. You look at your budget, you look at your grocery list, and you are forced to make an impossible choice. Do you cut back on nutritious food? Do you skip a dose? Do you risk becoming a financial burden on your children? The very thing you swore you'd never do? These aren't hypothetical scenarios. These are the gut-wrenching trade-offs millions of American seniors grapple with daily. Study after study confirms it. Over half of all Americans, and an even higher percentage of those over 65, report delaying or skipping necessary medical care, treatments, or prescriptions solely because of the cost. They are rationing insulin, postponing surgeries, avoiding doctor visits until symptoms become unbearable. There's a growing sense, a deep-seated disillusionment, that the American healthcare system, despite its pockets of excellence, often feels designed more for profit than for patients. When hospitals operate like corporations focused on maximizing revenue, when insurance companies erect barriers to care, when pharmaceutical companies prioritize profits over accessible prices, where does that leave the patient? Especially the vulnerable, older patient on a fixed income? It leaves them anxious. It leaves them feeling powerless. It leaves them playing a high-stakes gamble with their health and their life savings. And it systematically steals the peace of mind that should define retirement. U.S. healthcare versus the world. The comparison is often stark, and increasingly, Americans are looking elsewhere for sanity. Healthcare sanity abroad. So where are they going, and what are they finding? The data suggests over 650,000 Americans have expressed a desire to move abroad, specifically seeking better, more affordable healthcare and Social Security benefits. They aren't chasing exotic thrills. They are searching for healthcare sanity. They are seeking relief from the crushing anxiety of the U.S. system, and many are finding it in countries consistently ranked among the best countries to retire. Let's look at a few popular examples. Consider Portugal. It boasts a highly rated national health service, the SNS, accessible to legal foreign residents, often for very low copays. Waiting times for specialists can sometimes be an issue, like in many public systems, but the quality of care is generally excellent. And for those who prefer private options, top-tier private health insurance in Portugal, offering access to modern hospitals and English-speaking doctors, can often be secured for around $100 to $300 per month for someone in their 60s or 70s. Compare that to potentially much higher costs for comprehensive coverage in the U.S. Imagine this story, echoed on countless expat forums. An American retiree living in the Algarve trips and suffers a nasty fracture. They're taken to the local public hospital, seen quickly, treated professionally. Perhaps they pay a small copay, maybe less than $50. No surprise bills arrive months later, demanding thousands. The dominant feeling isn't fear of the cost, but relief at the efficient, affordable care received. Or take Costa Rica. Long known for its Pura Vida lifestyle, it also offers reputable health care. Foreign residents can join the public system, the CJA, typically by paying a percentage of their reported monthly income, which for many retirees is still significantly less than U.S. insurance premiums. While the public system can have queues, it provides comprehensive coverage. Alternatively, Costa Rica has a thriving private healthcare sector, popular for medical tourism, with many U.S.-trained English-speaking doctors. Costs for major procedures, like knee replacements or cardiac surgery, can be a third or even a quarter of the U.S. price, often in JCI-accredited facilities. Remember the man with stomach pain? In Costa Rica, his only concern was getting better. The crushing weight of potential financial ruin was simply absent. And then there's Mexico. Its proximity makes it a convenient option for many American retirees, especially in established expat communities like Lake Chapala or San Miguel de Allende. Legal residents can enroll in the public IMSS system for a remarkably low annual fee, often between $500 and $800 for those over 60. While navigating the public system requires patience, it covers most needs. Mexico also boasts excellent private hospitals, particularly in major cities, offering care at prices significantly lower than north of the border. Prescription drugs are dramatically cheaper. A medication costing hundreds in the US might be available for a fraction of that price in a Mexican pharmacy. We heard a story about a couple needing knee replacement surgery. In the US, they were quoted over $40,000 per knee. In a high-quality private hospital in Guadalajara, Mexico, they had both knees done for around $16,000 total, with excellent results. What connects these experiences? It's not just about lower prices, though. That's a huge factor. It's the feeling described by so many expats. Healthcare feels more human. Doctors often spend more time with patients. There's less bureaucracy, less feeling like you're just a number in a profit-driven machine. Crucially, in these systems, healthcare is largely decoupled from the terror of financial ruin. It's treated more like a public utility, a right, rather than a luxury commodity. This shift doesn't just save money. It restores dignity. It reduces chronic stress. It delivers that elusive, affordable healthcare abroad. Yes, but more importantly, it delivers a profound sense of security. It delivers retire abroad, peace of mind, the safety equation. But the search for peace of mind extends beyond the doctor's office. As the original script highlighted, there's another darker undercurrent pushing some Americans to look elsewhere, a growing sense of unease about personal safety in their own country. Safety, that bedrock expectation of any stable society. Yet for many in the U.S., it feels increasingly fragile. The respected Global Peace Index has consistently noted a concerning U.S. safety decline over the past decade, placing North America among the regions showing significant deterioration in peacefulness. The reasons are complex and debated, but some factors are undeniable. The horrifying frequency of mass shootings casts a long shadow. The daily toll of gun violence, claiming over 40,000 lives annually through homicides, suicides, and accidents, is a uniquely American tragedy. Political polarization has sometimes spilled over into social unrest. Crime rates, while fluctuating, remain a persistent concern in many urban and even suburban areas. For many, especially those with children or grandchildren, this isn't just abstract news. It translates into a low-level, background hum of anxiety in daily life. Remember that heartbreaking detail? Families teaching young children to drop to the floor at the sound of gunfire. What does it say about a society when that becomes a necessary life skill? Think about the prevalence of active shooter drills in American schools. Grandparents hear about these drills and worry, a fear their own generation largely never experienced. It's the calculation made before walking alone at night. It's the hesitation before letting teenagers have the freedoms previous generations took for granted. It's the feeling, spoken or unspoken, that you constantly need to be aware, on guard. And just like healthcare, safety in America increasingly feels like something you have to buy. Gated communities, expensive home security systems, choosing neighborhoods based on crime statistics rather than community feel. It feels less like a shared societal protection and more like an individual burden, stratified by income. Now contrast that feeling with the experiences reported by many American retirees abroad. The family now living in Lisbon, Portugal. The parents' biggest worry? Traffic lights, not gunfire. A simple, profound shift in daily anxiety. Many popular retirement destinations like Portugal, Spain, and Costa Rica consistently rank higher than the U.S. on global safety indices and boast significantly lower rates of violent crime. Expats often talk about the simple relief of being able to take an evening stroll without constantly looking over their shoulder. They describe communities where neighbors look out for each other, where children play more freely in the streets. Even in Mexico, where headlines often focus on cartel violence, which is a serious issue in specific regions, many established expat enclaves like San Miguel de Allende or Lake Chapala maintain a level of perceived and actual daily safety that retirees find compares favorably to, or even surpasses, that of many U.S. cities. It's not that these places are utopias without problems. Crime exists everywhere, but the nature of the daily safety concerns, the level of background anxiety is often reported as fundamentally different, less pervasive, less existential. It contributes significantly to that overall feeling they left America to find. The search for peace of mind. So what does this all tell us? This great escape, this growing trend of Americans retiring abroad, seems to be driven by something far deeper than just a desire for cheaper tacos or picturesque beaches. It appears to be a quest to reclaim something fundamental that feels increasingly elusive back home. As we've explored, for millions of American retirees, those promised golden years are being tarnished by pervasive anxiety. They aren't simply leaving America out of spite or lack of patriotism. Many are actively fleeing. They are fleeing the crushing, terrifying gamble of the U.S. healthcare system, where a single illness can mean financial ruin. They are fleeing the background hum of insecurity, the anxieties about personal safety that have become woven into the fabric of daily life for so many. They are desperately seeking peace of mind. They are seeking it in places where affordable healthcare abroad, keyword, feels less like a privilege and more like a right, where communities might feel safer, calmer, more connected, where the fundamental needs for health and security feel more attainable, allowing them to finally exhale, relax, and truly enjoy the retirement they worked so hard for. Perhaps this isn't an indictment of American ideals themselves, but rather a pragmatic, heartbreaking response to systems, healthcare and safety nets, that many feel have fundamentally failed them when they needed them most. It's a choice, often made with a heavy heart, to prioritize personal well-being and tranquility over national identity, when the two seem increasingly at odds. We've heard the stories today, we've looked at the stark comparisons. But beyond the logic and the numbers, there's a feeling. For those of you watching who have made that leap, who have retired abroad, or perhaps are seriously dreaming of it, what does that hard-won peace of mind truly feel like, compared to the anxieties you may have left behind? Can you capture that feeling? Share it with us in one word in the comments below. Serenity? Relief? Freedom? Tell us your word. Finding affordable health care and a sense of safety are perhaps the biggest emotional drivers. But making the move itself involves practical hurdles. Navigating visas, understanding foreign tax implications, transferring finances, building a new social network. It can all feel daunting. So to help you bridge the gap between the why and the how, watch our next video where we break down the practicalities. Top 5 countries for American retirees in 2025, focusing on healthcare, safety, visa requirements, and cost of living. Click the link on your screen now